you today?
Good, how are you?
Good, thanks. It's nice to see you again.
Nice seeing you.
I'm just going to be doing a couple things today. We want to get a good look at a heart assessment, cardiac assessment, a pulmonary assessment, and I'm also going to check out your hips. Okay? So I'm just going to put my gloves on. And I'm going to start by taking all of your vital signs. And this is thin enough, we're just going to do it right over it. You can just relax your arm. Really good. About 118 over 82 there. Okay, and this is just going to tell me your oxygen and your pulse here. And while that's going, I'm just going to take your pulse manually. Great. Your pulse was about 80 and your oxygen was 99. This is just going to tell me your temperature. And this goes right on the side of your forehead right here, okay? Great, 98.2. Okay. So do you ever experience any shortness of breath or chest pain, anything along those lines? No, great, okay. Are you pretty active?
Yeah.
Great. All right, so what I want to have you do is just lie down. Great, thank you so much. I'm just going to expose your chest here. Okay, so first I just want to feel down to your fifth rib here. Okay, and what I want you to do is just take a long, deep exhale and just hold it for a second. Great, okay, thank you. You can breathe normally again. Now I'm just going to listen. Good, thank you. And still, you can still just breathe normally. Great, thank you. And now what I just want you to do is you can just sit on the side of the bed here. Thank you. And I just want to listen to that heartbeat again while you're sitting.
Okay.
Good, thank you. Just cover you back up. And sit behind you.
Okay.
And I'm going to put my hands on your back, and what this does is when I have you inhale, it's going to show me that everything is equal on both sides, okay? So I'm just going to put my hands right here, and then take a big, deep inhale. Beautiful. One more time. And exhale. Great. Everything looks really good. Okay. So now, I'll stand over here. What I'm going to do is I'm going to put my hands on your back and on the front.
Okay.
And what I want you to do is, I know it sounds funny, but I'm going to have you say the word 99 quite a few times while I just go down your back, okay? So you guys start whenever you're ready.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Great, thank you so much. Okay. Now, I'm going to get on this side again, I apologize. Alright, so you're just going to hear me, or feel me I should say, tapping all down your back, okay?
Okay.
Okay, very good. And now what I'm going to do is I'm just going to place my stethoscope on your back, and I'm going to have you take some deep breaths and some inhales and exhales, okay? And what I'm listening for is just to make sure your lungs all sound clear in all the lobes, okay?
Mm-hmm.
So whenever you're ready, take some deep inhales and exhales. Great, thank you.
Alright.
That's done with the breathing portion now, okay?
Okay.
Sorry if that makes you feel lightheaded at all. Okay, so what I want you to do now is if you can just lie back down on the bed. Thank you. This time I'm just going to expose the bottom part. Alright, and now I'm just going to feel at the top of your hips. Sorry if that's a little bit ticklish. What I'm doing is I just want to make sure everything is even. This looks good. Okay, so with this part of the exam, I'm just I'm testing your hips and your range of motion. Okay, so what I want you to do is while you're lying, do it this way so we can so you can see what I'm doing. So with your right leg first, I'm just gonna have you straighten it and raise it as far as you can up. Perfect. Great. Thank you. Back down. And same thing with the left leg. Great. Get a nice ab workout at your doctor's appointment today. Okay. And so now with both legs, we'll start with the right one. I want you to do the same thing. I want you to flex your hip, but bend your knee while you're doing it, okay? So bend the knee and bring it all the way back. Great. Thank you. Okay. And same thing with this one. Bend the knee. Beautiful. Thank you. No pain while you're doing any of that, right?
No.
Okay, great. So now what I want you to do is I'm going to have you bend your knee, but keep your foot on the bed there. Okay, and what I want you to do is angle it out. So this way, perfect. Thank you. And then back in as far as you can. Good. No pain there?
Nope.
Good. Straighten that one out. And same thing with this one. Great. Good job. And back in. Beautiful. Thank you so much. Okay. And then the last thing I want you to do is put your legs together here. Okay. Now I want you to, with your legs straight, take the left one and pull it all the way out. Yeah, great. And then I want you to cross it back over that one. Beautiful. Same thing with your right leg, please. Really good. Thank you. And back across. Okay, good job. All right, and no pain with any of that, right?
Nothing.
Good. Cover you back up. Okay, so now what I want you to do is if you could just stand, please. Great. And I'm going to just stand behind you. And I just want to measure the top of your hips here. Make sure everything looks even. Good. Wonderful. Okay, so now I want you to keep your torso straight up, and I want you to put your leg back like that, okay? So keep your torso as straight as you can. Good. Great. And the same thing with that one. Sometimes it can be tough to balance. Okay, thank you. All right, so any pain with any of that?
Nothing.
No, okay. Wonderful. So keep doing what you're doing. It sounds like, you have a great diet, you got a good exercise plan. So keep it up, and we'll see you again in another year, okay?
Awesome.
Great, thanks. Nice
Well,
seeing you.
I'll see you too.